afternoon, this is Dr. Do again. This video is on alphabetic list of problem. Still on letter D. I'm going to talk about the diplopia. Diplopia actually. It's what is diplopia? It's double vision. So for example, I have a pen in front of me, but I see two of them. So this diplopia actually is belong to the subspecialist to confirm the diagnosis and also to find the cause and to treat it. And since this diplopia is not only the eye problem, can be neurological or can be immuno disease or can be systemic disease. So then I just put it here. If you see these double visions, if it is a refractory problem, for example, you can see your ophthalmologist. However, if it is metabolic or neurological or systemic immune disease cause this double vision, then probably you need to manage by either primary care or other specialists. It depends on the causes. So basically, this is diplopia. Any situation you need to see the emergency. Yes, if it is especially if it's the diplopia caused only one eye. When you cover your one eye and you still see double vision, that means really could be the serious neurological cause from the brain. For example, if you're older people, you have high blood pressure, diabetes. Again, those kind of, every time we talk about the systemic disease for older people, these are really culprits for many other complications. So if that's the case, then could be the stroke, a sign of stroke, either with or without other neurological deficit. If it is two eyes, if you, for example, if you see double vision right now, I see two figures of myself, if you cover one eye, the double vision disappeared, which means that's probably very likely is eye problem, either the muscle weakness or the refractory problem or the corneal problem. So then if that's the case, you really need to see a physician to correct by ophthalmologist. Either the muscle weakness can cause this or the muscle problem can cause this double vision. So if that's the case, you need to see an ophthalmologist. But that was not if the eye problem, like the muscle problem, caused the double vision. It's not an emergency, but you need to see a physician as soon as possible, especially for children. But if it is a double vision for older people with other systemic disease, with or without neurological deficit, then you need to see, especially if it's monocular. If you cover one eye, the double vision is still there. So that means it's, and when you open another eye, it's probably with or without double vision. You need to see the emergency, probably indicating stroke or neurological deficit cause this diplopia, double vision. So having talked about that, any double vision can manage at home? Probably not, even though it's subtle. For example, if I see two figures of myself right now, unless it is, you know it, you just couldn't sleep well, your eyes really tired after blinking several times, it disappeared, so it's okay. But if it is persistent, you seeing double visions persistently, then you need to see physician, ophthalmologist or other specialists to manage. You cannot manage at home. So anyway, what are the causes for the double vision or diplopia? So like I said, there are many causes. The eye problem itself, or just the lazy eyes, for example. Usually that occurs in children, and also later on with subtle injury you do not notice, or viral infection. After viral infection, the muscle was kind of weak. You can have this double vision, or the systemic, like the muscle problem, systemic immune disease caused the muscle weakness. I mentioned it before. Then because the muscle, intrinsic eye muscles cannot move the eyes coordinately, so then you see double visions. That's possible. So and also the neurological. We know the three nerves, three cranial nerves innervate this eye muscles around the for the eye movement. Any of these nerve problem is peripheral nerve problem or any the muscle problem. There's 6 muscles around the eye to make the eye movement and coordinate each other. If one of those muscles have problem, you also can have the double vision. And these could be caused by the, like I said, systemic disease like autoimmune disease or any other systemic disease, or could be caused by the neurological causes like the stroke. Minor stroke cause one of the nerve has neuritis, or the viral cause neuritis, or the idiopathic neuropathy. All of these can cause the double vision. The message is if you the take-home message is check your eyes frequently, cover one eye and cover another one, see whether you have it. If some of the double vision caused by the one eye, monocular double vision, you cannot tell, or you can, but if you test it, then you know what kind of problem it could be. It could be the eye problem, could be the neural problem, so you know where to go. So anyway, this is a kind of complicated, sounds simple, could be simple, but could be complicated, a serious problem. And how to address this, I think I need to make a summary. So first of all, make sure whether you have or do not have the diplopia, which is double vision. If you do, then I ask you to do one thing, cover one eye and then cover another eye, see whether the double vision still consists or exists. So if or disappeared. So if you cover one eye, the double vision disappeared, which means the 2 eyes misalignment, very likely caused by the eye muscle weakness or by the refractory problem. So if that's the case, then you see your eye doctor. But if you cover one eye, the double vision is still there, that means probably it's from the central nervous system, from the nerves. So that's the case, you need to see the physician as soon as possible, especially for older people with the other comorbidities like high blood pressure, diabetes. That means probably the problem could be serious. Oh, there's some other, if young person, you have this double vision, could be caused, like I said, neuritis, viral cause neuritis, or idiopathic neuropathy can cause this double vision. If regardless what is the cause, if you have it, you need to see a physician. The only double vision like I mentioned, can manage by yourself. It's like short lasting. You know you have been looking at the computer for 12 hours and you feel tired, you feel like the letters on the screen jumping and double, each one is double line. So if that's the case, then you blinking and then you massage, see whether it disappears. If no, then my advice is stop it and rest probably 30 minutes and see whether you're getting better. If no, then you need to see a physician. Regardless of the cause, if seeing double vision, there must be something. If seeing a physician in time fashion, if it's nothing serious, then can be excluded and get advice from your physician. That next time you know that you cannot spend 12 hours on a screen, the eye muscle getting fatigued, so that can, if that's the case, can cause the double vision, diplopia. So basically, I make a summary here because majority of case, the diplopia need to manage by your physician, either the primary care specialist, neurologist, or the eye physician, eye doctors, or other specialists. So the take-home message is check yourself whether the double vision is from the fatigue, and then you stop to look at the screen for so long time, or if it's just it's the problem either for eye problem or neurological causes or idiopathic or any autoimmune causes. So then regardless of what, you need to see your physician and to direct you where to go, how to proceed for the further care, to diagnose or to exclude. So this is the video about diplopia. It's quite a little here and there, but I hope you get the message. Just follow with your physician, make sure nothing serious going on with this diplopia. Thank you for watching. I will see you next time.